We are very well into the 21st century. Technology has enabled us to do incredible things. We have seen what only our forefathers imagined. We have explored the depths of ocean. We have traveled light years. Humanity is screaming with joy and celebration more than ever. Yet, there are screams of pain we are not able to address. It requires not only a technological vision but a kind heart to use this modern technology to relieve human pain. Meet our visionary Dr. Jagdish Hiremat, whose vision is to bring the robotic technology for the healthcare to India.
From the time when I started the company, I had only one dream, the dream of trying to bring the best technology to the people of India, the best possible surgical devices to India.
He was instrumental in envisioning the first robotic surgery hospital in India, AASRA Hospitals, in the heart of Bangalore city.
At AASRA Hospitals, we believe that technology should reach the patient.
Technology that deals with millimeters and micrometers of precision.
We wanted to give precision care to our patients.
Precision care is our core philosophy. With robot-assisted precision surgery, we are able to operate most difficult surgeries with care.
To bring it to India and to bring it to our country, to make a robotic surgical center where every major surgery is brought to the patient with robot assistance with zero human error, and to make the patient get up and smile the next day was a dream come true for us.
Our aim is to use the most advanced technologies to provide the best possible care to the patient and get them home at the earliest.
One of the major advantages of robotic assisted precision surgeries is faster recovery times.
With the cutting-edge technology, patient becomes alright almost like magic in a day.
AASRA is that dream which has come true. AASRA actually means Advanced Academy for Surgery, Robotics and Arthroplasty.
With robotic-assisted precision surgery, we are able to operate most difficult surgeries with ease.
The advantage of robotic surgery is minimal skin incision, that is a smaller skin incision is placed, minimal tissue handling and pain-free surgery, and hence faster recovery.
This type of robotic assisted which can be used in the knee joint, in the hip joint and shoulder joint at present.
The advantage of using a robot in thoracic surgery, that is in the chest cavity, is that it is very precise, because the area in which we are working in chest cavity is very small and there are very large vessels there in the chest cavity.
Robotics is a boon for modern gynecology. Robotics has made our surgeries easier. Accuracy of the surgery is 100%, and the suturing techniques is simpler when compared to laparoscopic surgeries. Thereby, the complications and morbidity to the patient is reduced.
And for expecting mothers, we place epidural, that is lumbar epidural, which will help the mother experience safe surgery and painless surgeries.
In the field of infertility, we do robotic surgeries for reanastomosis of tubal, that is tubal reanastomosis, and treatment of endometriosis, and in various other infertility procedures.
When it comes to sports injuries and when it comes to the spine problems, there is a solution with endoscopy for the spine and keyhole surgeries for the sports injuries.
The things that we can take care by using robotic or minimally invasive surgery in the chest cavity, or the diseases related to lungs like tuberculosis of lung, especially aspergillomas, and bronchiectasis, where patients can have recurrent hemoptysis, that is blood in the sputum. And you can also take care of other problems related to the chest, that is the thymomas or myasthenia. In patients with myasthenia gravis, you can remove the thymus using minimally invasive methods, especially robotic. Even larger tumors can be handled with minimally invasive methods.
Pre-operatively, we will take the patient to the CT scan. The CT scan is made such a way that it has to assist the robo. Here, what is robotic assisted? The robotic assisted is the one which uses the GPS technology. That means that the patient is on the table. We have got a special iris, what we call a radiation, that is a signals which sends from the knee to the camera, and from the camera it goes to the monitor. It shows how the knee is positioned and what we are cutting, how much we are cutting, what should not be cut. So we get the 3D technology in front of us and on the screen. This will not be in the regular conventional technology.
Now, in surgeries like TKR and THR, which is total knee replacement and hip replacement, the main concern for the patient not to approach hospital and to get treated is the pain factor. Now, by using ultrasound guided nerve block, the patients are pain free. Not only pain free, we make the patient walk on the same day of surgery. So this is the advantage of ultrasound guided nerve block.
What will be a commonplace in healthcare 5 years from now is already being used in AASRA hospitals to put smiles back on hundreds of patients.
What we see today is actually future brought forward.
In AASRA hospital, we have two robos. One is a soft tissue robo, which we use to dissect the soft tissues. The other one is a macro robo, which we use for ortho cases.
This is a first FDA approved in the world. The technology comes from the Stryker company, USA one, and there are out of 1,500 installations, the first installation which has been done in AASRA Hospitals, Bengaluru.
We were the first to bring Mako robot to Bangalore, to Karnataka. We have been the first to bring Vercius platform to non-neurological surgeries.
This provides us with the ability to perform the most complex surgeries like liver resections and pancreatic resections and other GI cancer surgeries, which would traditionally require a long incision by small cuts.
We have used it in gynecology, we have used it in soft tissue, we have used it in GI surgeries, we have used it in cancer surgeries.
The precision of these robots amalgamated with the focused care of the experienced surgeons is nothing short of a magic. On top of the cutting-edge technology, AASRA also ensures the process, systems and protocols for seamless healthcare experience for the patients and their loved ones. The goal is to get the patients back to mobility as early as possible.
We at AASRA, as a robotic surgical center, mainly focus on quality life of the patient.
For this, we practice ERAS guidelines. ERAS guidelines is nothing but enhanced recovery after surgery and anesthesia. This is a set of protocol which we use, which we implement in the patient so that the recovery is faster and they get back to their daily activities as early as possible.
The keyhole surgery is the mantra which helps to get back to the activities normally by repairing the rotator cuff muscle.
We also can take care of cancers in the cancer related diseases like cancer of the lung with minimally invasive method, and also esophageal cancer, which is very difficult to do. I mean, it is a morbid procedure if you do it by open method. If you are able to take care of it by minimally invasive method, either video assisted thoracoscopic surgery or robotic surgery, it is always leads to a faster recovery, even in a major surgery like esophagectomy or in lung cancer resections.
And for difficult cases like thoracic surgeries, like robotic assisted esophagectomies, gastrectomies, and robotic assisted pneumonectomies, lung resections and all, we place thoracic epidural. Now the advantage of thoracic epidural is not only pain management, but also which will help the patient to breathe well in the postoperative period. Now this will shorten the stay in the ICU, and hence the hospital discharge will be faster, and hence enhance recovery.
Our patients suffer less, our patients smile more.
Apart from surgeries, AASRA Hospital is also equipped to handle any medical emergencies ranging from falls, accidents to cardiac arrests.
We are well equipped to handle emergencies and would deliver the quality care with our skilled doctors and trained staff.
At AASRA, we have a team of experienced emergency doctors, nurses and paramedics. Our emergency care starts before the hospital enters the hospital only. We call it as pre-hospital care. Once they enter a hospital, we will triage the patient as per their medical emergencies and treat them accordingly.
We believe that patients should be treated like family members.
And we also aim in improving our quality of care by doing regular debriefing and discussions as a daily basis. We also train doctors to take up airlift ambulances and on-road ambulances also.
We hold the patient's hand right from their entrance and take them through the surgery, and till they get home, we take it as our responsibility to give the best possible care to the patients.
So right from the point of entry till the patient goes out of the ER, we look into each and every minute details of the patient.
Last week, we had a difficult case of hysterectomy operated robotically. The size of the uterus was 18 to 20 centimeter fibroid uterus. The patient recovered on the post-op day 0 and was discharged the next day.
Apart from the treating normal emergencies, we have also specialized in treating cardiac arrest patient. That is our main work stream, where cardiac arrest is where we will restart the stopped heart, or we will restart a heart which is beating abnormally.
We have an instance where patients have lost hopes on back to normal and delayed in getting surgical procedure done. We treat these patients in AASRA and they are doing pretty well in terms of their daily routine activities.
This has been our passion, this has been our goal. AASRA will continue to strive to give futuristic healthcare delivery systems to our patients. Going forward, we will be having spine robots, we will be having neuro robots available in our place.
There is no longer for the people to suffer with the pain. We are here for you.
If you're looking for surgical care related to chest cavity or gastrointestinal disorders, we are here for you.
We are here to provide you with micro incision surgeries, with minimalistic pain after surgery, with early and faster recoveries, with early mobilization, and with you being able to get back to your work and your daily life at the earliest possible time. Always remember, when you think about surgery, you do think about AASRA, and also remember that we are always here for you.
Think surgery, think AASRA. We are here for you.
At AASRA, we are here for you 24/7.
We are here for you at AASRA.
Think surgery, think AASRA, and we are always there for you for this. Thank you.
Think of surgery, think of AASRA. We are here to care for you.
Think surgery, think AASRA. We are here for you.